All right, welcome to the podcast, everyone. We have another really special guest that I am just so excited to have on. Neha Shah is here today. And so Neha is a registered dietitian specializing in GI and IBD for close to 20 years. She holds a master's degree in public health from Loma Linda University, a bachelor's degree in nutrition from California Polytechnic University. She's certified by the Commission Dietetic Registration and the Academy of Nutrition in Dietetics. Currently, she is affiliated with the University of California, San Francisco, specializing in IBD, GI, and short bowel syndrome. Neha also runs her own IBD private practice, Neha Shah Nutrition LLC, aiming to provide specialized care to the community. Within her practice, she offers a subspecialty in South Asian GI and IBD. Beyond clinical care, Neha has authored nearly 30 manuscripts on GI and IBD nutrition topics. She actively participates in several professional committees, including her role as a member of the Short Bowel, prior inaugural leader, and IBD nutrition work groups within the Dietitians Gastroenterology Disorders subunit of the Academy for Nutrition and Dietetics. She also serves on the National Scientific Advisory Committee of the Crohn's and Colitis Foundation and the Healthcare Professional Engagement Committee of its Northern California chapter. Additionally, Neha is the co-nutrition editor for the Journal of Practical Gastroenterology. Neha is committed to continuing her involvement in patient care and GI initiatives to advance nutrition care and to improve patient outcomes. So awesome. Thank you so much for being here. It's such an honor to have you. And you're actually our first dietitian we've had on yet. So
Oh,
yeah,
really? Well, thank you for the invitation. It's an honor to be here today.
yeah. So I would love to know, this is just from my own curiosity, how you got into nutrition and how you specifically got into specializing in GI, short bowel, and IBD.
Okay, in a nutshell, to really fast track my 20 years in this area. So, I've been a dietitian, as you already mentioned, since 2004. And how I got involved initially with gastroenterology is when I first got hired at Stanford Healthcare, I was a per diem dietitian covering for different services. And my favorite service was the GI surgical service. So when an opening came up for a full-time dietitian to take on that unit, I contacted my director and just informed her of my interest to take on the service along with other services to become a full-time dietitian. So that's the first start of if any dietitian is interested in taking on a service, express interest. Okay, that's really important. And then from there, inpatient, counseling patients by bedside for those who are recovering from GI surgery. And then I was working on a colorectal surgery project with the colorectal team, and they were just discussing to me that there is no dietitian at the GI clinic at Stanford Healthcare. And I'm like, okay. So I was chit-chatting with the patient by bedside. He mentioned Dr. Shamita Shah. I will always give her a shout out because she helped me get into the clinic. And I just went ahead and emailed her discussing some details about the project. I also contacted her because she had the same last name as me. So it was a little bit of a connection there. And at the end of this message, I just asked her, if you're interested in having a dietitian come into your clinic, just let me know. And it just took off from there with meeting with her, meeting with the chief. They wrote up a business plan. And I was that first dietitian to come in at Stanford Healthcare. So I started and built up the services for all the programs, including outpatient enteral nutrition, outpatient parental nutrition, outpatient short gut. And then a little bit down the line, I took on intestinal transplant for 10 years. And then, fast forward later, still in the field, I've written a ton of manuscripts later, participated in a lot of research studies. I continue to lecture, provide lectures to didactic programs such as GI fellowships, and I have my own private practice now with similar specialties. So that's in a nutshell. There's a lot more, obviously, because it's spanning over 20 years, but that is a nutshell.
It's like you fit 3 careers into those 20 years though. That's amazing. You really have done so much to help advance the field in IBD
Oh,
and
thank you.
short
I
bowel.
appreciate
Yeah.
hearing that.
I feel
Yeah.
like I'm even at like a loss of words from reading your bio beforehand and just listening to you right now too. It's just so impressive. And I'm glad that you've been able to like take that and run with that. That's so great to put dietitians there because it's such a big emphasis on nutrition and how
Absolutely. And I think one thing I will say it again is that a lot of dietitians come up to me saying, how did you get in the field? How do I get in the field? I'm like, you have an interest? Who can we talk to express that interest to? I was really lucky enough that the gastroenterologist I spoke with, I mean, she literally texted me the next day and we met up for coffee. And that started the whole process of me coming into a GI clinic. But no one's going to know of your interest if you do not speak up. So it starts with expressing interest, and it will always start there. So I will tell every dietitian, how do we bring that forward into words so we can move forward with your goals? So yeah,
Yeah, also 30 manuscripts, like 30
close to
different
30.
like I've been working on one for like 2 years. That's amazing. That's really cool.
Thank you. Yeah, I do enjoy writing. I feel like it does bring a nutrition voice to the literature. And dietitians have a place there for sure.
Yeah, especially in GI,
Oh,
it's such an area where we need more dietitians and more voices. Yeah.
oh, definitely.
Yeah, so we brought Neha here today because we were wanting to talk about the relationship between culture and food and how to navigate that when you have a tough diagnosis like IBD. So I know you've discussed this in different presentations. I've seen some
Yes.
of them. They're great. So I guess we can start off by, chatting about what is food culture and how does that play a role in our food choices?
That's a great question, and it always starts there. Food, as we all already know, it's a part of culture and starts early in one's life, even before one can read and write, when our parents are starting to introduce foods to us, right? Food culture includes a formal definition there is the beliefs and values and attitudes a community may accept or not accept around food. And certainly food practices within a culture can vary within regions or even communities within the same region in the same country. So with food culture, there's so many different influences on food culture, but overall food culture can also shape how eating practices are passed through generations. This is learned, it's not inherited. So certainly when we are counseling our patients, they are bringing forward what they have learned over the years as well. And we, as dietitians, we need to be able to work with this. Gender and social roles, including roles between males and females, or even how manners are expressed at the table, is all expressed in food culture. And certainly religious rituals may offer blessings through food. And certainly food is also a part of celebrations are offered to respect customs. And certainly again, so many different influences on food culture, even the setup of the food system within a community, how food is obtained and prepared and bought are all part of food culture. So when, again, as dietitians, when we have a patient in front of us, they're going to bring all of this forward. And we need to help our patients learn how to connect the foods that we are recommending for IBD to their culture and form that bridge so we can optimize diet and treatment and management of IBD.
Yeah,
Yeah,
absolutely.
that's great.
And then Neha, like when it comes to food culture and dietitians, we can sometimes think as well about cultural competence. And why do you think that's important to include as part of the piece for IBD?
Oh, definitely. So I will definitely say again, food culture is very personal. It is connected to, even I would hear some others say, and this is also in the literature as well, that food practices is a means of expressing one's identity that words or emotions may not. So cultural competence is overall what we're aiming for. And the formal definition for that is really involving the capacity to apply skills and function effectively to enhance cross-cultural communication between the clinician and the patient in practice. So to really apply cultural competence, skills for cultural sensitivity comes into play, as well as cultural humility will need to come into play as well. So cultural sensitivity involves also increasing awareness and appreciation of cultural practices. And then certainly cultural humility involves just being open to hearing about cultural practices. So gaining an understanding of cultural practices as it relates to nutrition, the food culture, it is important to bring all of this in to allow appropriate diet counseling to take place. And in the process, we'll also build up rapport with patients so they feel heard as well. So I can't stress enough that the clinician will bring their own culture in, their own food culture in, and then we have our patient bringing their own culture and food culture in. So how do we improve that communication piece between the two individuals? And this where cultural competence will come in.
And that was kind of going to be the next part of my question too, is for new dietitians or even not so new dietitians, what's something that we can do to bring in that culture competence and highlight that with the patient?
Absolutely. So with patients, new patients and current patients at the same time, it is really important to work backwards. It is very common to inform patients to follow a certain diet, maybe other clinicians outside being a dietitian, and then give a handout of what foods to eat, what foods not to eat, the importance of fiber, and so forth. And then my patient will often ask, I don't recognize some of these foods on this handout. Where can I find them? How do I eat them? How do I get my family to accept these foods as we eat meals together as a family? So we need to be able to work backwards and learn first from the patients. Tell me a little bit more about what type of fruits and vegetables come into the day. Or can you tell me a little bit more about the ingredients used to make that food? Because as dietitians, we may or may not always recognize that particular entree within a culture, but we may be able to break it apart a little bit more if we learn the ingredients are used to make that food. So I cannot stress enough, ask questions to show interest, ask questions to learn more. Don't just rattle off a list of foods without knowing what is in the diet.
Yeah, there's definitely some significant challenges, I feel like, in the area of nutrition with cultural competence for sure, given, we have a large majority of dietitians that are female and white, right? So there's
Right.
can often be limitations with cultural competence, and even when you look at research, like even looking at the research overall, I mean, we're starting to see more, inclusion of cultural diets, but a lot of times it is very geared towards one direction and not incorporating a lot of cultural foods. So have you seen anything change within research that you feel like is like a positive step forward in terms of creating better guidance for
Absolutely.
that?
I think there's a greater interest to include cultural needs and of the patients into research trials, into patient education handouts. I certainly have attended various webinars throughout the years on cultural foods within different cultures. So there is a lot of interest to bring that forward. And as a clinician, we have a responsibility to learn what all that is to help our patients optimize their cultural diet. And I can highlight fiber as an example where, again, keeping your questions open and allowing the patient to respond, maybe using fruits as an example, the type of fruits that we eat in the United States could be a mix of between cultural fruits and Western fruits. And then that a patient moving from a different country, they're only used to a certain set of fruits that they normally would eat in that country. So learning a little bit more about their cultural fruits and then knowing where we can access them can also bring in that fiber. Does that make sense from that angle? Same thing with cultural vegetables, cultural grains. Dairy is approached in the culture. And then we, as dietitians, would be like, okay, there appears to be a certain number of servings of fruits in the day. As long as there is a certain number of servings of fruit, that's fine. They're tolerating it. Great. We'll keep it. And then we know that that fiber from that fruit is important to include as a part of IBD. But again, we have to work backwards to learn the terms that the patient is using to describe their cultural fruits as well. Yeah.
Yeah. So a lot of like active listening, and trying to
Yes.
learn the person, there's a lot of importance to that, what they want to get out of it, how you can really support them. Yeah.
100%.
What would you say to maybe the patients that are listening that maybe have experienced like a negative experience with a practitioner that,
Sure.
maybe thinking, well, these cultural foods are bad, or I don't know what that is, so just do this, or like black and white thinking around it?
So this is where I have learned so much from my patients over the years. And I will be honest, if I'm not familiar with that entree, but again, I want to show genuine interest to learn. Can you tell me a little bit more how you make that food? I always like to explain why I'm interested as well, because I'm really, as dietitian, we're so used to analyzing every little ingredient and every little nutrient in that food to see how it interacts with our gut, right? So I do explain to the patients why I'm interested to learn a little bit more about the ingredients in that food. Can you tell me a little bit more about the foods that you think you can't eat? Because sometimes we know that maybe they can, right? So with patients advocating for culturally competent nutrition care, I will request that they meet the clinician halfway and provide that information about the type of fruits that they're eating, the type of vegetables that they're eating. What are some common entrees? Oh, is there a holiday coming up? Can I eat these foods? I'm happy to describe what's going to happen in this holiday. But as long as the clinician, I hope, shows willingness to learn, I hope that at least opens the door for the patient to share more, or certainly even asking to see a dietitian or a clinician that may speak a similar language or belong to a similar ethnic group can be also helpful. I know a lot of my South Asian patients, they come to me directly because they will tell me, I don't feel like describing what this food is. I know you'll just automatically know what that is. And that's a sense of comfort, and that's their right to ask as well. But if we're working with a clinician that is not aware, then definitely take a little bit of time to explain that. And the clinician who is genuinely interested in learning more will ask questions and help guide you as well.
Yeah, that's good advice. Just kind of advocating for yourself a little bit.
Mm-hmm. Exactly. Another technique, I have patients do, is that say if they're given a handout on a list of foods for a particular diet, and they're like, okay, I don't see my foods here. But then if we look a little bit deeper, I will have them actually take out a pen and circle the common ingredients in their diet, because food lists are just food lists. They're ingredient lists. There's no, like, you go to the grocery store, you buy all these food. Now it's sitting at the table. What do we do with it? So I like for them to circle the foods that are commonly eaten off a food list. And they're like, oh, I actually have these foods, but this is the way I eat them. They didn't really fully recognize like the ingredient list to the entree or food that they're eating, because there's different terminology as well. So that's another technique I'll have my patients do to help them recognize the ingredients that they're already using, but it might be just different terms because of the culture.
That's a really good tip.
Mm-hmm.
Yeah, that's great. So how would you how would you help a patient navigate kind of dietary concerns or GI concerns around, holidays and religious holidays like Diwali or Ramadan? I know several of my friends that during Ramadan will have a lot of gut pains and gut issues because of just the
Yes.
nature of it. So do you have
I
any?
have that come my way as well. Absolutely. So navigating the diet around religious observances and holidays within the culture is such a common question that I get. I'll use Diwali as an example, because that is a holiday that I also celebrate as well. And sweets as an example, are often given as gifts or used to celebrate holidays. And then my patients with IBD, my South Asian patients with IBD that celebrate Diwali, they'll come up to me and say, I'm told I can't have any sugars. So how do I make this work? And this is where I come in, and we, as dietitians, we know that portions also make or break tolerance as well. How can we treat the sweets as a taste testing? What are the ingredients used in the sweets? Is that something that you feel like your body can tolerate? I'm a big believer in, if I'm hearing statements that I'm told I can't have it, I read somewhere on, a website that I cannot have sweets, and it's really important to clarify any misinformation provided around sweets and IBD, and then you can move forward to addressing how to eat sweets. So we need to provide the what first, the background, correcting the misinformation in order to get to the how. So using sweets as an example, I have never told anyone not to eat sweets. I think it's going to be dependent on how much, how often. Encourage my patients to partake in holidays because it's a part of a celebration. If we're looking at sweets and, like, say someone who is gluten-free and dairy-free, then what are some of those options that we can bring forward, or the patient can bring forward and give as a gift as well? So again, some of those sweets can be shared and they're not isolated from sharing the sweets as well. So there's different ways that we can go about to do that as an example. And again, I'll also highlight fasting is such a common religious ritual in South Asia. So it could be a combination of partial fasting during a part of the day, or one may eat later, or there is just no food at all and only water for a day or more. It really depends on the nature of fasting. I think with fasting is a little tricky because I certainly want my patients to observe fasting if this is something that they want to participate along with their family members and friends. At the same time, I'm also monitoring their clinical signs and symptoms of IBD. Is there a risk for dehydration? Are symptoms worse with fasting? It's a hard balance. So I think it's going to be more individualized from that perspective. It's hard to answer that question without knowing the background and how the patient is feeling. But I do try to encourage fasting. However, it's also coming with a set of personalized guidelines to do it safely.
Mm-hmm. Yeah, that's all good to hear because I think, speaking from a patient standpoint, one of the challenges is at first you kind of feel like you just can't do anything anymore. Like you feel so
Right.
isolated from,
Right.
because your gut's telling you that everything is a trigger. And
Yeah.
and so it's encouraging to hear. It would be encouraging as a patient to hear like, hey, maybe there's a place and a way that you can still fit those things that bring you joy into your
Yes.
life again, just in a different way.
Absolutely. With fasting, using that as an example, I think it depends on the type of symptoms that may come my way. I find constipation often comes my way when one is fasting in an ongoing, not just a day, but there are several days where there's fasting, but it's often related to also there's partial fasting and then they're eating another part of the day, like Ramadan. So I like to look at the list of foods eaten during that time. Where are the foods that can possibly help with fiber that we can eat a little bit more of? How much fluids is one drinking during that time to help stay hydrated or even reduce the risk of constipation? Yeah, again, it's very personal.
Yeah, definitely.
And I guess like on the topic of constipation, there's always something we're mindful of as dietitians,
Of
and
course.
that is fiber being a big piece of it. There's obviously more than just that, but I was hoping maybe now we could talk about fiber and highlight that piece.
Absolutely.
Why it's important in the diet for IBD. I feel like as dietitians, it's probably one of our favorite topics to talk about because we know the importance of it.
Yes.
But just to understand too, and to think of anyone listening, to talk about how we can include more cultural fibers into the diet and what that could maybe look like.
Absolutely. So to reiterate, fiber is only found in fruits, vegetables, whole grains, and legumes. It is not found in meat, poultry, fish, dairy, or eggs. Fiber serves as a nourishment to the gut microbiota, overall the gut microbiome that resides in the gut. A low fiber diet, amongst other risk factors, is a risk factor to developing IBD, and including fiber in the diet has been shown to reduce inflammation, reduce the risk of flares, or when especially done alongside medications can help also, again, reduce the inflammation. I may have a different answer in a year or two, but diet alone, I have not seen to completely put one in remission without any use of medications. But diet alongside with medications has been helpful to help reduce inflammation or even help put one in remission. So the diet matters. I hear this all the time. Does diet matter? No, diet matters, especially with the use of fiber coming into the diet. So as a dietitian specialized in IBD, it's going to be a huge focus on how do we include the fiber at each meal? And there are different types of fibers in the diet, and different types of fibers have a different impact on the gut. So if one has a lot of gas and bloating, I may not necessarily recommend that big bowl of chili that may possibly aggravate that gas and bloating. Or we cook the beans a certain way where we soak the beans in a certain number of hours and we cook with new water to help reduce its gas producing potential. Or if one has a lot of diarrhea, maybe adding more banana and oatmeal and a sweet potato can be helpful to reduce that. So we try to match up the fiber to help with the symptoms while also creating an opportunity to continue to eat fiber in the diet and feel well with it. And one more comment. So again, all food cultures will include some element of fruits and vegetables and whole grains and legumes. This is the cultural fiber. So how often all these foods are consumed is really dependent on the practices within the food culture. The goal is what to add more often within the culture for fibers as able than what to take away so we can provide positive reinforcement for the diet.
Yeah, I really like that you highlighted the fact that obviously diet is important and we know that, but understanding as well that it's okay that medication is that piece that helps too, because it's a big component too.
Of course.
Yeah.
Yeah.
Ashley, did you have any other questions?
Yeah, so I know you have a really special speaking event coming up at DDW, which stands for Digestive Disease Week, which, tell us a little bit about that and what you're going to be talking about. And
oh gosh, it's a great opportunity for me, not just for me, but there's other dietitians speaking at Digestive Disease Week. It's not often that dietitians are speaking at Digestive Disease Week. So the fact that we have several this year is a huge plus. I'm doing 2 talks this year. The first talk is Nutrition and IBD at the AGA postgraduate course, AGA meaning American Gastroenterological Association, where again, I will be co-presenting along with a gastroenterologist and a GI fellow. And then my second talk is on weight inclusive care in a GI setting for clinical care. So my topic as a part of that session is how to collaborate with a dietitian for weight inclusive care. So those 2 talks will be in the next upcoming 2 weeks. And I'm really looking forward to bringing that nutrition voice to the conference and sharing updates and knowledge with all that who are planning to attend.
that's awesome. And congrats on that honor. That's great. So with weight inclusive care, so I know we could do an entire episode, and maybe we will at some point on that topic, but for those that aren't familiar with that, can you tell us what that is?
Yeah, absolutely. So weight inclusive care, what this involves is that it's not involving interventions and strategies to change one's weight, especially to promote an intentional weight loss to treat a diagnosis. We, using a weight inclusive approach, will look at the whole patient and really will pull in strategies for diet or even physical activity as an example to help treat the symptoms, to help improve quality of life without such a huge focus on the number of pounds that need to be lost from that example. So using a weight inclusive approach or working with a dietitian who applies a weight inclusive approach, certainly we want to hear the goals related to your weight if it comes up, but it's not going to be the sole focus of working with a dietitian. We're going to look at every aspect to help one feel better, one sleep better, one move better, and go from there. Using a weight inclusive approach, different body sizes will come my way. And just because one is in a larger body versus a smaller body, it does not tell me anything about that person's health. So again, I want to reduce the stigma involved with different body sizes. I'm looking really focused on where my patient is at, what are the goals, how can I help reduce symptoms, how can I help improve quality of life, how can it expand the variety in the diet for overall good health.
That's awesome. Yeah, I can't wait to have that conversation at some point, because we've made
Yes.
weight like the central focus since like the 90s. And, now finally we're coming back around to the appreciation that it's definitely not everything when it comes to health. And it's very minimal, in terms of what people actually need to focus on.
Absolutely. 100%.
Yeah, well, thank you so much for being here and really appreciate you taking the time to chat with us. And it's been really nice getting to chat.
Yes. Thank you for inviting me. I appreciate it.
All right, we'll see everyone next time.